everyone. My name is Chase, and I am the project coordinator for the Tobacco Education, Prevention, Outreach, and Cessation program in the Research and Student Development Department. And I am joined on the IHC podcast by some very special guests today. So if I could have you introduce yourself.
Yeah, my name is Dan Calac, and I am the Chief Medical Officer here at Indian Health Council. Been here for the last 20 years. I take care of the adults and the pediatrics here in our community. And great to be here today with both you and Joaquin.
Yeah, Joaquin, we're so excited that you're here at IHC joining us today, joining us from Alzheimer's San Diego.
Yeah, so my name is Joaquin Ortiz. I am the Director of Education for Alzheimer's San Diego. Alzheimer's San Diego is a local regional organization. We're not affiliated with any national organization. Our work just stays just here within San Diego County. All the money that we raise is meant to provide really social services and support for people who are affected by dementia, and especially their caregivers, because caregiving for someone with dementia is an enormous task. It eventually becomes a 24-hour day, 7-day-a-week job. Yeah. So on the whole, our organization provides all kinds of different support services. So we provide support groups. We have a call-in line. We have respite services, things like that. To really provide for those families in need. And sometimes they're not families. Sometimes it's friends, it's neighbors. I mean, sometimes it's a whole community to take care of someone. My responsibility as the Director of Education is really to bring free educational programs out to the public. So we try to spread those across the county as far as we can and as best as we can. But then the other big part of my job is to kind of be out there as a face for the organization and try to build relationships like these so that we can serve all of you and bring you these services, because everything we do is free. And there's so many people in this county who are affected, and they don't even realize that there's an organization down the road from them that wants to help.
Yeah, that's really exciting for me, because the best thing about what we do here at Indian Health Council is just the collaborations that we create between different organizations, and especially in regarding to dementia, because we were blessed to actually have a 2-year starting grant looking at dementia and education around the community. And then we're lucky enough to actually get a 3-year extension on that grant. So now we're doing dementia and models of care. So looking at incorporating these different support systems like Alzheimer's San Diego, collaborating with you, Alzheimer's organization, the county, with UCSD, just a variety of other individuals that are in the community, which really helps build up and provide great resources for diagnosis, referral, support for caregivers, education, and just resources as a whole. A good example is, we have an event coming up sometime this summer. I think we'll mention that later on, but it's a great way to kind of get those communities involved and get the education out there en masse. So I'm really glad you're here today. Awesome.
Yeah. That was a really good introduction. I know you guys have connected before, so you're no stranger to Indian Health Council. So for some of our listeners who may not know, can you maybe explain what dementia is and how that ties into Alzheimer's?
Yeah, I mean, this is a question that I get a lot, as somebody who's out in the community trying to educate the public, and I have a team of a couple of other people, one of whom speaks Spanish and offers these programs in Spanish as well. I think the big thing is that people are confused by that. They say, I don't understand the difference between Alzheimer's and dementia, or even my doctor said that I have, mixed dementia, but I don't understand what that means, and what does that mean in relation to Alzheimer's? So dementia is just a wide term for a set of symptoms that a healthcare system, a doctor will see in someone, and it's cognitive changes, right? So the one that we're most familiar with is memory loss, right? Like a lot of us who've interacted with somebody who has Alzheimer's, a specific type of dementia, will say, oh, well, they don't remember my name anymore. They don't remember what they had for lunch. They don't know what year it is. They don't remember that I'm their grandson, things like that. So memory loss is one of those symptoms, and it can be a leading early symptom for a lot of people. But a lot of people don't realize there's a lot of other symptoms that can pop up even in the earlier stages of dementia, and they don't realize they should be getting help. One of them, for instance, is disorientation, people getting lost in a familiar place, for instance. Another thing is processing challenges. Somebody tries to balance their checkbook or try to make their favorite recipe, and they can't do it anymore. Or they experience, for instance, they're not able to learn anymore. These are all challenges that are happening in the brain. The brain's not able to process in the way it used to because of some kind of damage. Generally, that damage is coming from some kind of disease. So the primary disease that causes dementia, the one that mostly affects older adults in this country, and is the most widespread and common type of dementia, is Alzheimer's disease. It's a specific disease that slowly degenerates the brain, and gets worse over time. The challenge with it is a lot of people hope that it's very easy to track, and it's not. We don't know how long somebody's going to have Alzheimer's for. We don't know how severe each of the different symptoms is going to get. It's very unique for each person. So the challenge, I think, is that a lot of people are worried in general about Alzheimer's as a whole. And really, what they're really concerned about is dementias as a whole is the thing, because there's a number of type of dementias. There's another type of dementia called frontotemporal disorders or frontotemporal degeneration or frontotemporal dementia. It goes by a bunch of terms, but we just call it FTD. That one actually affects more of the front part of the brain and tends to cause a lot more behavioral issues. Yeah. I actually sadly just saw a presentation really recently, a national presentation, that was saying that people with FTD unfortunately have a higher tendency to either cause harm towards themselves or others, which leads to criminal situations. Yeah. So undiagnosed, it could mean that somebody gets criminal charges without us realizing it's a disease that's causing that. So much of the importance of what my organization does and what my department does is try to help people understand to be compassionate towards people that have dementia. For instance, we do train law enforcement, we train other healthcare professionals, and we train the general public, especially family caregivers, because nobody wants this. Nobody wants to have their brain not working in that some way anymore and then not be able to remember or act violently or misbehave in public or something like that. Nobody chooses to do this. In the same way we wouldn't blame somebody for having like some kind of congenital heart disease that they inherited. And we don't know the causes of dementia yet. We don't know, for instance, what causes Alzheimer's as a specific disease. And that's why there's limited treatments and there's no cure. So our organization, the best we can do is provide and support really good care, because that's the treatment right now until better treatments come along.
Yeah.
Yeah, you really hit the nail on the head. I mean, that's a really great way to kind of start us off. I was just returned back from Santa Ynez. I went to the tribal listening session. So I had about 40 people out there. Like about 150 people out in the audience. And so we did a short mini-cog. A mini-cog is one of the tests that we use to look for people who have dementia or neurocognitive disorder, just problems processing information. So there's a couple of those. There's the mini-cog, there's a mini-mental status, there's the SLUM St. Louis exam.
The MOCA.
The MOCA. Yeah. So, I have a room of about 150 people, and I'm doing my presentation. And as you mentioned, one of the big things is, do I have it or don't I? And so that's a big concern for a lot of people in their 60s, 70s, and I often kind of couch this in the setting that says you have a 60-year-old brain, which the main people are like, well, thank you very much, Dr. Calac, but you really kind of do. And like any other part of our bodies, our brains get tired. There's a lot of risk factors that go into some of these developments. We think developing into dementia, which include a lot of toxic substances, lack of sleep, high blood pressure, lack of good nutrition, tobacco, alcohol, other neurotoxic, traumatic brain injuries potentially. So there's a lot of things that could happen. And so for people who are in their 60s and 70s, I mean, they may have been exposed to a lot more of those things earlier on before Indian Health Council actually was out having preventive health and providing the level of care that they provide now. So in this room of 140, we did a short mini-cog and everyone passed. But it was kind of funny to see the people who actually wanted to draw the clock, and I asked them, let me see all your clocks, and everyone had a great clock. But that's one as one of the components of the mini-cog. But it's comforting for people to know in settings like that, and the community, in these elder meetings, that it's normal to actually have periods where you kind of forget things. But as you mentioned, it becomes more of a concern when it's really affecting your life. If you're getting disoriented, if you're losing money, if you're losing your keys for a taste at a time, your phone. And we're so interconnected nowadays that we need to have these points of contact that are very important. So it's equally as important to know what is normal versus what is abnormal. So thank you for that input.
And I think that's something you touched upon. A lot of the risk factors that are so important for people to keep in mind, is that, again, things like heart disease, different kinds of traumatic brain injuries, and just a history of concussions and things like that. Comorbidities like diabetes and things like that increase people's risk for dementia, unfortunately. Another one, though, that gets tied back that we don't talk about openly enough is level of education. Right. There's just been research, unfortunately, that shows that people with less education are higher risk for dementia, and that's frightening, especially when we talk about communities of color, who have had less access historically to education, to quality health care, to all those things. That means that a lot of these communities are at higher risk. And a lot of what we're trying to do, and especially with the education department, is move our programs out to those kinds of communities like East County, like South County, like Northeast County up here, to make sure that people know and have access to those resources like us, because they aren't aware that those things actually are leading to more of that. And that's, again, not their fault. Nobody chooses to not want to be as educated as other people are, Now, we don't know, again, all the reasons and causes, but the other challenge is that people feel so much stigma. People are so fearful of dementia. That they're afraid to go get diagnosed. And the thing is, a lot of our health systems don't take that time. So the fact that Indian Health Center is making a point to really make sure that the mini-cog is in place, we're really supportive of the mini-cog, by the way. It's a really good tool for diagnosis. Or at least getting a baseline. It's not the only diagnosis tool, I should be clear about that. But at least in getting some steps there, we also offer free memory screenings like that. Now they have to be done in person. And we have an office in Kearney Mesa, and then we do office hours up in San Marcos at One Safe Place. So, if people wanted to access us, it's a little bit harder from the tribe here. I'm glad that it's here at IHC, because the thing is, people need access to keep an eye on that. In the same way that you're getting your blood pressure taken every time that you're going to the doctor, once you reach a certain age, we should really be also checking on this cognitive stuff. And it's just not a priority for a lot of health systems. And you know why? It's because for a lot of these health systems, there's just not a lot of money in dementia, because they're just going to pass the caregiving back to the community. There's just not a lot of treatments just yet, Now, I hate to be that ruthless about it, but that's unfortunately what drives some of these systems. And so I'm not saying that about here, but I think a lot of other people in the community aren't getting that opportunity. And that's what organizations like ours exist for. So IHC taking those steps to get a grant, to get in front of the community, to try and educate them, but offer those screenings is really vital so people can get ahead. Even just getting it before you have symptoms is critical, so you can go back later and try it again. And if you see a decline, you can start taking some steps, talk to your doctor, start going and getting some more of those further diagnoses. So,
is there a standard age that maybe our listeners should be aware of, where they should start going to be screened for this?
Yeah, that's a very good question. And so, with all the risk factors that Joaquin just mentioned in terms of the alcohol and the TB and traumatic brain injuries, smoking is definitely one of them. And so we're lucky enough to actually have a program here to kind of address that in-house, where we can actually call people like Chase and say, hey, I have a client over here. Would you mind seeing this person about their smoking use? So it's nice to have that in-house, that the TEPOC program that we have here is able to address that, on a daily basis. But the big issue in terms of when it starts screening is, it depends on the person. Really, it's really individualized, because if you have people, God rest his soul, a former charter football player who actually lost his life, or even our young athletes that get these TBI, the traumatic brain injuries, these concussions, and we even see these clients today. We're lucky enough to actually volunteer for a local high school football team, and one of our doctors provides the services on the field. But when they come in, they want to go back, right? They're feeling okay, but you can definitely tell that they're kind of fuzzy, and you need to let the brain kind of get better, repair itself, loosely said, and get back to at least some type of baseline. But generally, we start screening at 65.
Okay.
65 is the age. When we have a Medicare wellness exam, we start doing these screenings. But if there's any concern for some problems thinking, some problems with checkbooks, maybe some frontotemporal disorder issues, if there's a family history, because as you mentioned, Parkinson's, Huntington's disease, vascular dementia, frontotemporal dementia, Alzheimer's. There's just a variety of conditions that we really have to be made aware of, and it could be even something as simple as alcohol and/or drug use, just lack of care, homelessness. Might be a big issue, and unfortunately, we have this terrible problem with with homeless individuals. And as you mentioned, they may have a disease that may prevent them from getting the care that they need.
Mm-hmm. And I think it's hard. So many things and of the risk factors that are tied back to dementia are just wider health problems that tend not to be addressed, especially when people don't have as much access to quality health care and the resources needed for that. Because it's not just having access to health care, it's the resources to pay for all that too, right? And so things, again, that Dr. Calac is bringing up, not only just about the possibility of certain diseases that already exist or having traumatic brain injuries, but something like smoking is a really good example of, smoking is bad for your cardiovascular system. It's bad for your heart and blood is what I'm saying. And so the thing is, your brain and your heart are super tied together. Yeah. And so if you're not taking care of your heart, you're actually not really taking good care of your brain either. Mm-hmm. And so this happens to people where they develop forms of what are called cardiovascular dementias because it's related to these other heart problems and the brain has become damaged because of that. And so smoking ties right back into that, Heavy alcohol use can tie back into that too, There's even a specific type of dementia called Wernicke-Korsakoff syndrome that basically somebody who heavily abuses alcohol in their adult life can start showing signs in their 40s. So Dr. Calac is right in that in a general individual who's on the kind of normal spectrum, like in terms of like their overall health, 65. But if people feel that they've had a history of things that might have affected their brain, whether it's, again, drug or alcohol use, whether it is a history of traumatic brain injuries, or whether they're even seeing some of these symptoms that they're hearing about at an earlier age, they should start bringing it up with their doctors. Mm-hmm. And it's that stigma that becomes the problem because so many people are afraid of what's going to happen and the consequences. Mm-hmm. One big one is that nobody wants to be taken care of, right? It feels like you're suddenly a burden on other people, and dementia requires a lot of day-to-day care. But another huge one in this county especially is people are afraid they're going to lose their driver's licenses, And so a lot of people are afraid to go get a diagnosis because, a doctor is required to notify the DMV when a diagnosis comes down. And actually, it doesn't mean that you'll lose your license immediately, So I've been working with a client of ours for about a year now, and she is diagnosed in the early stages of Alzheimer's as a specific type of dementia, and she's still driving. But her doctor has said that there's going to be a coming time where that's going to end. Not because she's doing something wrong yet, but because he does have to set some timeline where as her disease progresses, she's just not going to be safe behind the wheel anymore. And I get it. For a lot of people, it's like, but I'm a safe driver, But the thing is, when you hear me saying that, that the dementia takes away your ability to process the world, that maybe it affects your judgment and your behavior and things like that, that you might not be able to see as well because that part of your brain isn't working as well, you're no longer safe to be behind the wheel of a car. How do you say that to somebody who lives in a rural community like this, where their car is frequently their lifeline to be not only connected to food and other stuff, but maybe their community? And we always emphasize the value of community as part of taking care of your well-being.
Yeah. Community is so important here, and family, and that makes a lot of sense. I wonder if for any of our community members who are caring for like their elders or other people in their family, maybe those elders are not aware that they're experiencing any of these symptoms. So what can some of our like younger generations kind of look out for? Are there signs that could maybe indicate that there needs to be a visit to a center to be screened or to IHC?
So Joaquin actually touched about something about the heart and the community, right? So that heart, that those cultural values, that spirituality that goes along with living in a community like this, runs very, very deep. And so for caregivers, thankfully we don't have this huge burden of dementia. We have a lot of risk factors, and that number definitely is going to be doubling, if not quadrupling, and in the near future, where we're going to have, so many more individuals diagnosed with dementia in the next 40 to 50 years. And so it's going to be a big public health issue. But the issue with caregiving is going to be much more of an issue as well, because many people don't have that ability to, either have transportation and have a job. And so if they don't have a job, then they would be caregiving. But if they do, as people become better established in their homes, as businesses move out into the East County, they have better access to positions. The casinos offer a way to seek employment, and before they were at home potentially taking care of their relatives, now they were going to work, and so that poses a very, very unique problem for people who are, as you mentioned, very wise, have been are in a survival mode, living for a very, very, very long time, and then all of a sudden, having problems with dementia. And everyone, as we talked about, is different. Dementia may come on quickly. Dementia may come on slowly. We just don't know. It depends on the person. But that issue of caregiving is so huge for all those reasons I just mentioned. The other big issue that I wanted to mention is that dementia is a life perspective disease and process. I mean, if the daughter has to take care of the grandmother, the daughter takes time away from their daughters and their sons from their husband and spouse, and so that issue of dementia really affects the whole life perspective of the whole family. So those resources of time, money, emotion is taken up by this individual. So this caregiver really assumes a major responsibility, and then having the options and resources for that caregiver to seek out care in local towns for long-term residential care is very difficult. The residential care is very expensive. The residential care has very specific qualifications that need to be met. Many times families just can't afford it. But if they do afford it, or they have Medi-Cal, Medicare, and insurances, then they're able to kind of get a position in those facilities. But staying in those facilities is not a vacation. It's something that can be very tough on the families as well. So I know Joaquin has more to say about that. I don't want to say too much more because we can share some of the stories, but it's very important for the viewers to really take that into consideration, because many times it's like, well, I don't want to do it, but I think I'll have to put mom in a home, and it's not as easy as it sounds. Once that happens, if it does happen, it's very difficult to go through that process, especially if you have a bad outcome. In the facility, she falls, she slips, accidents happen. She's in a large building with a lot of other individuals, and you don't know what the other individuals are like. So it can be something that has its own challenges as well.
For young people, the thing is that many of us live in multi-generational households.
Yeah.
And so a lot of young people, they have no idea that something like this can affect their grandparents or older adults, their elders, in a way that's going to be brought into the home, and caring for someone who has dementia is really challenging in terms of their mindset. You have to adjust your mindset to help live in their world and support and validate the experience they're having, even though it doesn't seem to fit with ours. And I say that because I'm living from lived experience. I do this work because I was a caregiver in my 20s for my grandmother. And so my father and I were trying to care for her. And it was extremely difficult. We were completely overwhelmed. And nobody ever explained to me what Alzheimer's was and what dementia was and what was going on with her brain. So I am being honest, on video, I was cruel to her. I would yell at her all the time. I would get really upset with her. I would take things away from her, because I thought that, why can't she just do these things? It wasn't until later on when I was doing a job related to a lot of this work that I learned these skills, and I was like, oh my God, what did I do? How come nobody ever helped me with that, I was even talking to my co-director who runs the supportive services stuff, and I'm like, well, but who's supposed to educate people about this? Because the healthcare systems are doing all that. Who's doing that? And she's looking at me. She's like, you. That's your job. That's what we do. It is that. It's that those resources aren't really out there, and a lot of young people don't realize that. And when I say you have to change your mindset, the challenge is that historically, it's been easier to just lock somebody away like this, and I don't even necessarily mean in a residence, because as Dr. Calac said, it's really expensive. The kind of going rate right now for a quality memory care residence is like $8,000 to $10,000 a month. Yeah. How many of us have that kind of? I can't. If my father develops dementia, there's no way we could afford that. There's no way, And I come from an enormous amount of privilege. My father's a professor. You would think that we would have this kind of thing in the bag, but no. Even when my grandmother had it, they went into debt to try and get her into a home, and we had to move her to Texas, where some of our other family was, where it was substantially cheaper. I say all that because we have to shift gears and rethink about how we approach this. And because if somebody's going to stay in the home, which is very likely for most of us, we have to think about how do we validate the experience they're having, because their brain just doesn't work in the ways that ours does anymore. And so we have to, in a lot of ways, try to be compassionate towards that experience, and rather than confront them and try to correct them and bring them back into our reality, is adjust ourselves to say, what are you experiencing right now, and how can I help with that? And I think there's a lot of native traditional wisdom that can help with that sort of thing, that young people can learn now and be comfortable with, and reinforce those values. Because I think what scares us is we see somebody who doesn't remember a name anymore, or doesn't remember the relationship they have with us. I mean, at the end, My grandmother didn't remember that I was her grandson. She thought that I was a cousin of hers. I never met that cousin. I didn't know who that person was. I don't even know if I looked like them or not. That's inconsequential. What was more important was, had I been able to play into that, I could have said, yeah, sure, that's who I am. Because does it really matter if she remembers me or not? But to provide that day-to-day quality care for her was more important, you know? And so I think that's a challenge for us, is to rethink about how we approach somebody and how we care for them, and not worry about so much about what we think they should be doing, but continuing to give them a lot of autonomy in terms of day-to-day choices in their lives. They may lose their independence, and that stinks. That's really difficult. But on the flip side, we can still have them have some control over what they do on a day-to-day basis and continue to involve them in something. That's so important, not only for them, but also for us as caregivers, is to do that as well. And so I think that's kind of where people have to start shifting. And the younger we can learn that, the more that we can not only help our own elders, but elders across our community who need this sort of help and support.
That's so important. And that's, thank you so much for sharing that. I think that's really
very powerful.
Yeah, and really good for our listeners to hear. So just wrapping up with our last few questions here. Obviously, I think, there's a lot to be said about like scientific evidence into sort of this preventative care. What are some things that like some of our younger generations can do to keep our minds and our brains healthy and active and really promote cognitive wellness? Yeah.
You guys are younger than me, so you guys go first. What should you be doing?
Well, at any age, I think it's important. At any age.
I think that, as we were touching upon before, just taking care of your overall health is really critical. And I see somebody who's not really that healthy in a lot of ways, but I'm trying to work on that, like managing your weight, making sure that if you have diabetes, you're controlling it. One that a lot of people don't realize, untreated hearing loss is also a risk factor. So if you're losing your hearing, get a hearing aid, take steps on that. Yeah, I know there's still even some stigma with things like that, but these are steps that are critical for your brain health, But the ones that I always really focus on that I think people don't always recognize and know is not to become isolated and to not get into too many brain habits, if you will, right? So when I talk about brain habits, I mean, like try taking a different route to the store, try going to a different store, try going somewhere you've never been before. And no, I get, look, we don't all have the means to travel to the world or do something like that, but try going to a park you've never gone to before, trying to go to a community event that you wouldn't have attended before. All those things challenge your brain to have to do stuff it wouldn't do otherwise, But I think the other big one is really socializing. This is such a huge thing, and especially in a community like this that is very social, but also it can be easy to fall out of that and isolate yourself if you want to, especially because it's rural. That's dangerous. Like you gotta connect with other people, and meeting new people is a critical thing on top of that. And I know it's hard. It's hard as we get older to meet new people. It's uncomfortable. It's not something we're familiar with. But the more that we socialize and use our brains in these new ways, the more likely we are to be able to combat some of this. Now, the reality is I can't tell you that doing that will not mean that you will never get Alzheimer's. We don't even know fully the cause of something like Alzheimer's, so that might not stop it. But taking those steps is at least doing preventative things and may even at least help to slow some of the decline, So I'm always trying to kind of push on stuff for that, especially for so many of our older adults who got isolated because of the pandemic, and maybe haven't pulled back out of that yet because not because they don't want to, but because they're afraid of catching things like COVID or other things, and they're not ready to go back in the community. I'm middle-aged and I'm still struggling to go back out in the community. So what does that mean for some of our older adults that have other health problems or limited mobility and things like that? And I think that's a great place where young people can get involved and say, hey, like, how do I help them to do that? Can I offer them a ride so they can come to the community event? Get involved with your community and help those elders to continue participating and be a friend to them, because this is going to sound cheesy, but we all need friends to help us get through this in a lot of ways,
Yeah. Very important.
Well, as we enter into these spring, summer months, talking about socializing and going to gatherings, we have some exciting events coming up here at IHC and in our community, including the traditional Indian Health Gathering coming up in May. Yep, got it in there, got it into the podcast today. So lots of opportunities for socializing and getting involved with the community for sure.
Definitely.
Yeah. So, well, thank you so much for joining us today.
Yeah, thank you very much.
Yes. Thank you. Been a lot of fun. Bye.